I'm Dr. Otto Janke. I want to thank you for being with me today. Let's talk about our healthcare system and the side effects of chiropractic. It's the stuff they just don't tell you about. You have to realize that our healthcare system is really not built upon you being healthy. It's quite frankly built upon you being sick to get into it. And today we're going to talk about chiropractic and the side effects of chiropractic. It's the stuff they don't tell you about. For you who want to contact me, please feel free to do so. My email is drjanke@jankechiropractic.com. You'll see it right down next to the little pup. First of all, this is that Kaiser Permanente, a large insurer in California, came out with a study a short time ago, a few years ago, that showed that the average American, man, woman, and child, was filling 12.6, approximately the number. So let's round up to 13 just for the ease of numbers. Approximately 13 prescriptions a year. Every person, the average person, was filling 13 prescriptions a year. There's no possible way that we get healthier by filling 13 prescriptions a year. And what's even more stunning than that is that Americans filled a record 5.8 billion prescriptions in 2018, and that was up 2.7%. And we have to imagine in 2020, that's gone up even more. We look at the percent of persons using at least one prescription drug in the past 30 days, and this was back in 2016. It was almost 50% of people. And percent of visits involving a drug therapy to a healthcare practitioner was almost 3/4 of the time. And absolutely astounding is that the most commonly used types of drugs included bronchodilators from ages of birth up to 11 years of age, central nervous system stimulants from 12 to 19, central nervous stimulants, and antidepressants from the ages of 20 to 59. We have got to come to the realization that our healthcare system isn't healthy and Americans aren't healthy. Bloomberg.com stated that nearly 1 in 2 Americans takes prescription drugs. Nearly 1 in 2. And we find that the average American is spending about $1,200 a year on prescriptive medications. And you know what? AARP came out and said, well, how can we help people to lower their drug costs? Well, let's take a look at that. One recommendation they had was to choose generics over brand name drugs, to order medications in bulk, to ask for free samples, apply for assistance, don't be too quick to toss expired medication, which is, you think it'd be contradictory to what you expect, and then get a different Medicare drug plan. Like, well, all those might be good options, but the one option they did not add in there was to be so healthy you don't need the medication in the first place. Seems like that would be the most viable option. And a study came out in 2019, 2015 National Drug Survey on Drug Use and Health sought to document the extent of the overprescription of opioids in the United States. The survey revealed that nearly 38% of the U.S. population, or 92 million adults, took doctor-prescribed oxys or Percocets. Astounding. And as the great Hulda Clark said, the human species can no longer afford to make a business out of illness. It sure seems like our healthcare system is an illness care system. How can we change that? We start looking at chiropractic. And I know many of you go to a chiropractor because of neck pain or back pain or headaches. But what are some other things that happen to you when you're getting that chiropractic adjustment? Well, they look at spinal manipulative therapy, which doctors of chiropractic are phenomenal at. It reduces the inflammatory cytokines. Why is that important? Because now, during the pandemic, the coronavirus pandemic, the research is showing that is a cytokine storm which adversely affects us and makes us that much sicker. Well, the spinal manipulative therapy reduces those cytokines. Isn't that what we want? This is from 2006. This is a phenomenal study. Another one of those side effects of chiropractic. The cost efficiency and effectiveness of including doctors of chiropractic to offer treatment under Medicaid. Now, don't get hung up on that it's Medicaid. Understand the benefits that go along with this. A critical appraisal of Missouri inclusion of chiropractic under Missouri Medicaid. They're the ones who came out with that study, in which showed that the 38% of U.S. population, or 92 million adults, took doctor-prescribed oxys or Percocets. What they found phenomenal in the study was that doctors of chiropractic don't prescribe opioids. And those who seek doctor of chiropractic guided treatment first save an average of 40% on annual healthcare costs. 40%? That's phenomenal. A side effect of being adjusted. Studies show that doctor of chiropractic care can reduce the rate of spinal surgeries by 60%. We'll see something about this later on. An insurance covering of doctors of chiropractic had lower annual total health care expenditures. You know, we're going right now during a presidential election. They talk about health care. Man, if we want to have better health care, we're going to need healthier Americans. The immediate effects of cervical spine manipulation in females. I mean, wait a minute. So we're seeing that when you get adjusted, we can help with neck pain, decrease overall healthcare costs, decrease surgeries. And the psychological responses in spinal manipulation, their conclusions were that there was some evidence that spinal manipulation improved psychological outcomes, neck pain, psychological outcomes, decrease surgeries, decrease overall healthcare costs. Those are phenomenal side effects of chiropractic. This is a phenomenal study. It came out in 2009. The developmental delay syndromes. What's phenomenal is this. This is a wild study. The study presents a case series of 157 children with delay syndromes, including the conditions such as dyspraxia, dyslexia, attention deficit hyperactivity disorder, and learning disabilities. And these kids received chiropractic care. What they find? Their ability to concentrate, maintain focus and attention, and control impulsivity, and their performance at home and school improved. These kids are getting better. Kids getting better. Neck pain, psychological outcomes, decreased overall healthcare costs, decreased surgeries. Some of the incredible benefits of chiropractic. The objective physiological changes and associated health benefits of chiropractic adjustments in asymptomatic subjects. This is the Hannon report. A significant amount of preliminary evidence supports that people without symptoms can benefit from chiropractic care. It's a lot like brushing your teeth. You brush your teeth so you can help them stay healthy. It is plausible, Hannon wrote, it is plausible that chiropractic care may be of benefit to every function of the body and have the potential for long-term overall health benefit to those receiving chiropractic care. What a great side effect of getting adjusted. The Atlas vertebrae realignment and achievement of arterial pressure goal in hypertensive patients. Hypertensive, high blood pressure. These people had high blood pressure. And I want you to understand, this is not from a chiropractic journal. This is from the Journal of Human Hypertension in 2007. And what they showed was this. When they started to adjust patients and get the first and second bones of the neck aligned, blood pressure got better. We conclude that restoration of the atlas, the first bone in the neck, alignment is associated with a marked and sustained reductions in blood pressure, similar to the use of a 2-drug combination therapy. and 81 patients with multiple sclerosis and Parkinson's disease undergoing upper cervical care. Once again, looking at the upper neck. And what they found was this. This is phenomenal. Not only decreasing overall healthcare costs, decreasing spinal surgeries, helping people decrease blood pressure as if it was on 2 medications, helping the kids, helping neck pain. They found that 40 of the 44 multiple sclerosis cases and 34 of the 37 Parkinson's showed symptomatic improvement and no further disease progression during the care period. Phenomenal. Again, they're not saying that they treated the disease or cured the disease. These people had no further disease progression. They got better. Increased telomere length. Phenomenal stuff. And again, this is from Molecular and Genetic Medicine. That journal. The people got better. From 1996, they showed that people under chiropractic care versus not being under chiropractic care had all these benefits, greater benefits by being under care. And why chiropractic care, maintenance care? This is from Coulter and researchers at the Rand Corporation. Nothing to do with chiropractic. They found that people who are under regular chiropractic care were free from the use of a nursing home, greater proportions. Free from hospitalizations in greater proportions. More likely to report better health status. More likely to exercise vigorously, which we all need. And more likely to be mobile in the community. Aren't these all the things exactly we want from a healthcare system? In one of the studies that came out in 1989, the Variability study, that there is a definite correlation between chiropractic care and superior health when they were looking at kids. And this article, I have to tell you, helped to change my professional direction and the effects of upper cervical adjusting on the CD4 counts of HIV positive people. CD4 counts are a great immune system marker in your blood. This is wild. They had 2 groups. One group got adjusted, one group did not. The control group, who did not get adjusted, did not see a chiropractor, experienced a 7.96, almost 8% decrease in the immune system markers, almost an 8%, while the people who were adjusted saw a 48% increase. A massive change. Immune system gets stronger. We're going to see people symptomatically better with Parkinson's and multiple sclerosis. We're going to see telomere lengths better, neck pain, blood pressure, kids getting better. Overall healthcare cost decreases in surgeries. Isn't this exactly the healthcare system we want? And if you want to talk nerve, you got to show nerve. And one of the best ways we show in my office and through many offices in chiropractic is how well the nervous system can be adapted and help to be better. Help the nervous system be better. And there's a tool, it's called heart rate variability. Let me show it to you. So we have 2 screens, we have 2 tests here. The one on the right, which we want to see 2 very, very important aspects of the test. One is, we're called reserves, but how much nervous system energy do you have to run that wonderful machine that is you? You want a lot of gas in your tank, don't you? Obviously. And then, is the nervous system balanced? Well, balanced between what? Between the sympathetic, that fight or flight side, and the parasympathetic, the rest and digest. So the one on the right shows that little white dot, that'd be you, that'd be your test. And that's ideal. There's a lot of gas in the tank, and it's right on the line, which shows the balance between the nervous systems. Awesome. The test on the left, we see that the dot has gone way down. It is less than half a tank of gas. And they're massively on that sympathetic side, that fight or flight side. Now imagine if you were during a worldwide pandemic and not sure if the kids are going to be in school this week or next week, and we have a presidential election coming on, maybe you might be in fight or flight. Well, what happens to you during fight or flight? Imagine there was a bear in the room. We talk about this in my office all the time. Imagine there was a bear in the room. Well, would your digestion be normal or abnormal? Well, abnormal. How about your ability to rest, to repair, to heal, what would your blood pressure be like? What would your cholesterol levels be like? Your ability to focus, to sleep, your sexual function. All these things get turned down, and it needs to be because there's a bear in the room. But you look around, you realize there is no bear in the room. That's the way you perceive it to be. And we start looking at the long-term detrimental effects that has on you and your health. So what we find here on this study is, this came out in 2006, the effects of chiropractic care on heart rate variability. And it's great. It improves it. And can chiropractic improve the autonomic nervous system, which is what the heart rate variability measures? Can chiropractic improve the autonomic nervous system? Well, we start to look at the Kessinger study, the Zhang study, the Wynn study, the Hart study, my good friend Amy Haas, my good friend Danny Knowles. And that's my study at the very end. All of these show that chiropractic has a positive effect upon the autonomic nervous system. We can help your nervous system get better. Phenomenal study is that, again, this study came from the huge journal called Spine. This is from 2013, early predictors of lumbar spine surgery. What they found is that approximately 43% of the workers who first saw a surgeon had low back surgery. But if you saw a chiropractor first, only 1.5% of those had surgery. Phenomenal. And if we look at chiropractic care in the Medicare population, this is life-changing. From 2014, results, the models show that chiropractic is significantly protective. I love those terms, significantly protective against a 1-year decline in activities of daily living. Just the stuff you do around the house, of lifting, stooping, walking, self-rated health, and worsening health after 1 year. It's protective. And the study provides evidence of a protective effect of chiropractic care against a 1-year decline in functional and self-rated health. Isn't this exactly what we're looking for? Not more drugs, not more medication, not more surgeries, but you getting back into living again. And then we talk about this study from 2007. And the results of this study is that the clinical and cost utilization based on 70,000 member months over a 7-year period, not a fly-by-night study, demonstrated decreases of over 60% in hospital admissions, 59% decrease in hospital days, 62% outpatient surgeries and procedures decreased, and a decrease of 85% in pharmaceutical costs when you have a doctor of chiropractic in your program. Isn't this healthcare? Think of all the benefits you can get by getting adjusted on a regular basis. The side effects of chiropractic, helping with all those different things that we see. I mean, you would take a look at this and think, how are all those connected? What makes all those things correlate and connected? Well, it's this, is that the human body is better with an optimized nervous system. With a nervous system. You know, just like your computer, you want to add all those different apps in, you got to make sure that it communicates with everything perfectly. And that's what we do best in chiropractic. Look at all those side effects you get, all those great side effects you get by being adjusted on a regular basis. We look at what the great Buckminster Fuller said, is that you never change things by fighting the existing reality. To change something, build a new model. It makes the existing model obsolete. I'm Dr. Rado Janke. If you have any questions, please feel free to contact me at drjanky@jankychiropractic.com. I look forward to hearing from you. And let's help you benefit from those great side effects of chiropractic care. Thank you.